The trigeminal nerve is the fifth and largest cranial nerve. It's a complex structure responsible for sensation and movement in face. The trigeminal nerve emerges from the brainstem and branches out to innervate different areas of the face. It is vital for various sensory and motor functions. Understanding its anatomy and functions is crucial for medical professionals. This knowledge aids in diagnosing and treating conditions related to the trigeminal nerve. It has three major branches: the ophthalmic, maxillary, and mandibular nerves. These branches carry sensory information from the face to the brain. They also control the muscles involved in chewing and biting. The trigeminal nerve is a mixed nerve, meaning it has both sensory and motor functions. The trigeminal nerve has three main branches: the ophthalmic, V1, maxillary, V2, and mandibular, V3 nerves. The ophthalmic nerve, the smallest of the three, is responsible for sensation in the forehead, scalp, upper eyelid, and nose. It also carries sensory fibers from the cornea, conjunctiva, and lacrimal gland. These fibers transmit sensations of touch, pain, and temperature from these structures. The maxillary nerve, the middle branch, supplies sensation to the lower eyelid, cheek, upper lip, and upper teeth. This branch is responsible for transmitting sensations like touch, pain, heat, and cold from these areas. It also carries sensory fibers from the nasal cavity and palate. The mandibular nerve, the largest branch, provides sensory innervation to the lower lip, chin, jaw, and lower teeth. It is responsible for transmitting sensations of touch, pain, temperature, and proprioception from these areas. This branch also carries motor fibers to the muscles of mastication, enabling chewing and biting actions. Each branch of the trigeminal nerve further divides into smaller branches, innervating their territories. This intricate branching pattern ensures comprehensive sensory coverage of the face. The ophthalmic nerve branches into the lacrimal, frontal, and nasociliary nerves. The maxillary nerve branches into the zygomatic, infraorbital, and superior alveolar nerves. The mandibular nerve branches into the buccal, lingual, inferior alveolar, and auriculotemporal nerves. These branches and sub-branches work together to provide a complete sensory map of the face. They allow us to perceive a wide range of sensations, from a gentle breeze on our skin to the sharp pain of a toothache. The trigeminal nerve plays a crucial role in transmitting sensory information from the face to the brain. It also controls the muscles responsible for chewing and biting. Understanding these sensory and motor pathways is essential for comprehending the nerve's functions and clinical significance. Sensory information from the face travels along the three main branches of the trigeminal nerve: ophthalmic, maxillary, and mandibular. These branches converge at the trigeminal ganglion, a cluster of nerve cell bodies located near the brainstem. From here, sensory fibers transmit signals to the brainstem. These signals then relay to various brain regions, including the thalamus and the sensory cortex. The thalamus acts as a relay station, processing and directing sensory information to the appropriate areas of the cerebral cortex. The sensory cortex is responsible for our conscious perception of sensations. It allows us to identify and interpret various stimuli, such as touch, pain, temperature, and pressure. The motor component of the trigeminal nerve originates in the motor nucleus of the trigeminal nerve, located within the brainstem. Motor fibers from this nucleus travel within the mandibular branch of the trigeminal nerve. They innervate the muscles of mastication, including the masseter, temporalis, medial pterygoid, and lateral pterygoid muscles. These muscles are responsible for the powerful movements of the jaw required for chewing and biting. Motor signals from the brain travel down the brainstem and along the trigeminal nerve to reach these muscles. This innervation allows for coordinated and controlled jaw movements, essential for eating and speaking.